Psychologist, author, and online educator. His best-selling books include 12 Rules for Life and Beyond Order. Have sold millions of copies worldwide. Dr. Peterson's lectures and podcasts consistently attract large audiences, providing valuable insights into topics such as mythology, psychology, and personal development. Dr. Peterson, thanks for being here.
Thank you. Thank you very much, Senator, and it is a pleasure and an honor to be here. I'm speaking today as a clinical research scientist. This is an endeavor with which I have some familiarity because I've conducted many such studies and I'm aware of their difficulty. I'm also speaking as a clinician and a parent and a sometime philosopher of science. We'll start with the general in this discussion and move towards the specific. Generally, it's vital to understand that science itself is an ethical, even a philosophical/religious enterprise. Why? Because the scientists who advance humanity inevitably operate within an a priori framework of faith. What are the elements of that faith? Belief that the world is orderly in its foundation, its nature and its spirit. Belief that such order is understandable to the mind of man and woman. Belief that the pursuit of such understanding is possible and laudable. And a belief that good itself will come of the pursuit of understanding. There's a meta principle that underlies these more explicit rules, and that is that the understanding that the scientific aim must be true for the truth to be revealed. This means that science aimed at career, prestige, professorship, and funding, to say nothing of darker motivations such as pride, revenge, or the wish for destruction, is not science at all. Much of what purports to be science now is instead the garnering of personal credit, career advancement, and economic gain that all derivative and essentially parasitic activity can temporarily produce. This does not result in truth. We should also not be confusing medicine, as currently taught and practiced, with science. The education of modern physicians may familiarize them with the basics of physiology and biology and the details of their specific practice. This is by no means the same thing as teaching them how to conduct or evaluate scientific research, which is something that takes years of specialized training to manage. Why am I making these points? So that we understand explicitly that aim and ethical orientation define the scientific pursuit. And so that we pay enough attention here today to establishing that aim and ensuring that orientation. When you're a scientist and you're doing statistical analysis, it's easy to believe, for example, if you don't know anything about science or statistical analysis, that the statistical process is a mathematics machine into which you pour data and crank out truth, and that is just absolutely not how it works at all. When you're doing statistical analysis, you're making 1,000 micro decisions, every single one of which is ethical. You have to decide which numbers to include and which numbers to exclude, and you have to understand why. And you have to work against your own hypothesis and even against your own research interests to ensure that you're not deluding yourself and the public. And if you're a careerist or interested in prestige, then all of that goes out the window and what you produce will be highly misleading to you and everyone else. It's very difficult to orient yourself so that you fight against that. You have to be terrified of the falsehoods that you might produce and where they might lead you and everyone else. And so now, having considered that, you have to start to understand what it is that should constitute your aim. What would it require in the case that we're discussing to make America truly healthy again and to orient true scientists toward that aim? It's a retooling of the research enterprise from the top down as well as the bottom up so that the goal would be clear, the incentives aligned, and the most productive actors identified, rewarded, encouraged, and capitalized. This could be facilitated politically by making a more specific goal clear. We could begin that, as we should, by formulating an appropriate diagnosis. We need to get the problem right. What is the major problem? What are the major problems bedeviling the American people? One such is public health, clearly, and more so all the time. Despite the extensive government spending in that domain, and despite the negligible attention historically paid to the details of health research and practice by the political class. American children are fat, diabetic, and increasingly miserable as they progress towards middle age. Those yet not captured in childhood by obesity, insulin resistance, high blood sugar, and inflammatory dysfunction are likely to suffer it then, with near certainty by the onset of a declining old age, and expensively so. What might we aim for instead? Slim, healthy, athletic, optimistic, and courageous children. Strong, psychologically integrated, generous adults. Resilient, active, productive seniors, still contributing to their communities. Combined with either or both of much less spending or much better results for the cost. How could this aim be accomplished? Within the community of health-focused researchers and practitioners and incentivized politically. America faces a multi-dimensional diagnostic conundrum. Its people suffer from a plethora of symptoms and syndromes. Too high and increasing body mass indices, rising blood sugar levels, associated risk for psychological disorder, immunological dysregulation that increases risk of neurological degeneration, cancer and heart disease, to name a few. My daughter referred earlier to her terrible childhood experiences, inquiry and experimentation, communication of all that, and the social consequences among a multitude of people with various chronic health conditions. What was her prime scientifically relevant realization? The answer to this question. What do all fat, sick, unhappy people have in common? At least this: they all eat. How could that brute and singular fact be varied and studied? It's a technical discourse on the formulation of adequate scientific hypotheses. Epidemiological studies associating any given dietary habit with some outcome of health inevitably fail, trying as they are to establish a correspondence between only two factors in a sea of causal possibility. Science can only progress, genuine science can only progress, when such inquiry is simplified radically so that single variables of interest can be assessed for causal significance. This is difficult to manage in the case of diet, but it no longer seems impossible. The reason? Because of the actual possibility of radical simplification on the food consumption side. Elimination diets offer a potential solution to this problem. Most of them make little sense, however, conceptually or scientifically. They eliminate foods in an often random and faddish manner, often because of the spoken or unspoken ideological concerns of their proponents. In addition, they're insufficiently simple. The range of foods involved, so that scientific analysis of causality can take place, must be reduced to the minimum for genuine analysis of causality to take place. You're chronically ill. You have a plethora of symptoms. You eat a multitude of foods. There's some relationship between the food and the outcome, at least in principle. How are you going to determine that? Well, no simple analysis is possible because of the multiplicity of factors, both on the symptom side and on the dietary side. So you reduce the complexity of your diet optimally to a single variable. Well, that's what my daughter Michaela did. Now, we know some things about such reduction. These are things that are important to know. Ketogenic diets switch the body to fat metabolism, so they constitute a step in that direction. If you flip your body to fat metabolism and your symptoms decline, then you know that the metabolic illness that you're suffering from has some association with glucose metabolism. Now, Michaela, I believe, or perhaps, yeah, it was Michaela, mentioned the fact that for a century, childhood epilepsy has been treated with a ketogenic diet because your brain won't go into convulsions if you're not feeding it sugar. That's a good example of simplification to a single variable. Now, another alternative or associated issue with ketogenic diets is restriction of carbohydrate and sugar intake. So they eliminate the contribution of the glucose-dependent metabolic pathway to obesity, insulin resistance / diabetes, and inflammation. Your body can burn sugar or it can burn fat. And in our society, we run primarily on glucose metabolism, but there's no necessity for that, not least because there is no recommended daily allowance for carbohydrate. Right, you can live with 0 carbohydrate, and 0 is not a lot. So that's a remarkable fact in and of itself, given that the primary caloric source in our diet, that we have in our diet, is actually carbohydrate. So that can be eliminated and the consequences analyzed, and that can happen relatively quickly, and people can do it, and it's inexpensive, and it doesn't harm people. So those are all very good things from a research perspective. The consequence of a ketogenic intake, switch to ketogenic intake, can be analyzed as well. You can monitor weight, blood sugar, and assorted symptoms of inflammation, including those associated with psychological disorder. The anecdotal evidence that we've picked up, because many, many people have communicated with our family, is that the typical obese person can expect to lose 7 to 20 pounds per month on a ketogenic or plant-free ketogenic diet, that will continue month after month until virtually all of their body fat is eliminated, that they can do that with no hunger, although there will be some cravings, which are not precisely the same thing, and that's actually maintainable over the long run. With that reduction in obesity comes radical improvement in blood sugar, for example, and often an improvement in the kinds of psychological conditions that Dr. Chris Palmer, for example, has been studying. It's a very remarkable concatenation of positive effects, some of which are quite unexpected, especially, I would say, on the depression and anxiety side, because those have been viewed for a very long time as consequences of life stress and trauma, and that can happen. But the fact that the psychological disorders seem amenable to treatment by ketogenic or plant-free ketogenic diets could be nothing short of a revolution, because those are very intractable conditions, and they're also sources of unbelievably immense suffering. Plant-free ketogenic diets, that's a carnivorous diet, let's say, or even more restricted, a carnivorous diet that's restricted to ruminant animals, push that simplification to its extreme. Well, why would you do that? Well, if you're trying to conduct a true scientific analysis, let's say, of the relationship between diet and health, you'd want to reduce the diet to the simplest